Hello, my name is Dr. Hunt, and today we want to talk about spaying dogs and cats. There's different ways to spay a dog and cat, and today we want to primarily focus on the differences of a laparoscopic spay versus the standard spay. To give you an orientation, I have a picture here, an illustration of the reproductive system in the dog and cat. It's a little bit different than what you might be familiar with in people. This is all inside of the belly. The ovaries, these guys up here, are about this far inside of the belly of most dogs, or maybe this far in most cats. So it's deep inside of the belly. And then they have the uterus, which is this structure right here. The uterus comes together and binds into the uterine body, which is a little bit different than people. People have a big uterine body and small uterine horns. Dogs and cats have big uterine horns and small uterine body. That's the cervix, and then this is the vaginal vault, or the vagina. Our objective today with a spay is to remove the ovaries. You can do ovariohysterectomies where you take out the ovary and the uterus, or a hysterectomy where you take out the uterus only, ovarian sparing spay, or an ovariectomy where we take out the ovaries. Today we're going to talk about ovariectomy only, where we take out the ovaries, as that is the standard across most veterinary practices, either ovariectomy or ovariohysterectomy. So there's two ways to do that. You can do a standard spay. A standard spay, you make an incision about this big in the belly, right about there. You take out the ovary, you reach in and grab that ovary and pull it up out of the belly, and you take out the ovary. And then you reach in on this side and pull that ovary out and put it all back in. Now the ovaries is way back here on the back side of the abdomen. Now there are some advantages to the laparoscopic over the standard spay. There's 5 advantages. It's much less invasive, it's laparoscopic, smaller incision, less painful, and the recovery time is, as far as exercise is concerned, there's no restrictions aside from swimming, bathing, and licking. There's still an incision, we don't want it to get infected. And as you can see in our video, we have a lot of visualization. We do a tour of the whole abdominal cavity. We look at the gallbladder, the liver, the kidneys, the bladder, the ovaries, the pancreas, the intestines, the spleen. And we have had many cases, or a few cases rather, where we've identified disease in the patients, such as no kidney, or just having 1 kidney instead of 2, or a polycystic kidney disease type of thing. So we've been able to identify those diseases with the laparoscopic technique, whereas the blood work suggested all was normal, and the patient suggested that they were normal as well. In addition, you can visualize after you take out the ovaries that there's no bleeding, and you can see that in the video as well. So those are some pretty tremendous advantages. The last advantage is that you have a smaller incision to work with. The incision's about this big, and you can see that there. And that incision is together not necessarily bigger than your standard spay, but separate. They don't present a post-operative complication such as dehiscence. Dehiscence is when the sutures come undone and then you have this hole in your belly. If this incision comes undone, then we have an issue, and maybe we need some antibiotics. If this incision comes undone, then you have a pretty significant complications where you can have intestinal contents slip through that incision, and that's a big complication that we can avoid with the laparoscopic spay. So those are the 5 advantages of the laparoscopic spay, and with the video I think you can see those pretty intently. The other thing that you'll see there in that video is there'll be a couple of pans over to the ECG. That's the heart rate. And you can see that heart rate stays very steady throughout the procedure. And many times with the standard spay, once you start to pull and tug on that ovary, that heart rate will increase. And that's an indication of some pain. Because that suspensory ligament, you have to stretch that suspensory ligament, because remember it's clear back here. I need to stretch that suspensory ligament to the point that I can pull the ovary out of the belly, and that's really painful for most patients. In the laparoscopic spay, we don't have to do that, so we can save your patient some pain with this procedure as well. So those are the benefits of the laparoscopic spay. I appreciate your time, and we'll talk soon.